everyone, welcome back to the Wandering Nurse Practitioners YouTube channel. My channel has shown travels, academic discussions, and how to balance your life. Live life to the fullest, because you will never know what happens next in your life. So let's get to it. Remember, I emphasize to consult with your provider for further questions and or concerns. This is not meant to treat, but to provide basic knowledge that will prompt you to either seek professional advice or not. So cough is a normal reflex of the body to get rid of something in your throat or your body. And cough and cold medicines containing dextromethorphan, brompheniramine, chlorpheniramine, diphenhydramine, doxylamine or guaifenesin, phenylephrine, or pseudoephedrine can stop your kids from breathing at night. The American Academy of Pediatrics wrote an article demonstrating that's related to cough and cold medicine, but they're rare, but it can happen. There were less than 3% of all reported cases over a 9-year period between 2008 and 2016. The American Academy of Pediatrics also recommends not prescribing Benadryl to children less than 4 years old, especially for respiratory encounters. Consult with your provider. So the guideline is, or the recommendations are, for children less than 6 years of age, except for antipyretics and analgesics. Over-the-counter medications for the common cold should be avoided. And for children 6 to 12 years of age, except for antipyretics and analgesics, we suggest not using over-the-counter medications for the common cold unless you consult with your provider. And then for adolescents more than 12 years old, over-the-counter decongestants may provide symptomatic relief of nasal symptoms. The bottom line is, if you're not sure what to give your kids, consult with your provider. Thanks for tuning in.